Good evening. Welcome back to Let's Talk About Mental Health. I'm Nels Kloster, an addiction psychiatrist and working in Southern Vermont.
My name is Robert Stack, and I'm a licensed alcohol and drug counselor and a licensed mental health counselor. Good evening.
Yeah, so I really enjoyed the show last week with Robert Whitaker Skyping in with us.
All right, it was great. It was for those of you who don't know, I mean, he's written some very interesting books, and in some ways, and to be honest, it's really been a challenge for me.
Yeah. And me too.
He really sort of questioned something. One of his points, and I can't even summarize them all together, but one of the things that he questioned was the long-term use of medications, and that maybe it's not helpful. And I know I've shared with you, one of my problems was that I spent, a long time in 29 years in a psychiatric hospital, and I used to tell my clients that being on their medications was part of their recovery.
Yeah.
Because a lot of people relapse when they got off their medications. And so this has been a real change for me, trying to think about, well, what does recovery mean? And I hope you don't mind, but I'll just say that, when we started treating people for opiate addiction in Vermont, when I first started working, it was always abstinence, and we'd recommend 12-step programs. And there were some medications, but we didn't use them too much. Antabuse, a lot of them, we just didn't use them much. And we would advocate abstinence and working a program and changing your life. And but in the last couple of years, I'd say last 5 years, I guess, we started treating more and more opiate addicts and people who are dependent on opiates, and we were sort of overwhelmed by the relapse rate, and we were sending people down to Greenfield for methadone. Mm-hmm. And they were traveling all the way from Burlington down there to get methadone. And then we, at some point, got permission to do Suboxone. And, so we started recommending Suboxone. But it really made me confused almost. And I've come to grips with it. I thought, well, it was beneficial, it was helpful to them. And as you point out, it served a public service to have them on medication. But after being involved with Whitaker and reading his books, I don't know, I sort of stopped. 2 weeks ago we had that question, and the person said, why are we treating opiate addiction with opiates? And then someone else asked, they said, I didn't get that when I'm an alcoholic, no one gave me alcohol. Right. So I don't know, it's a very kind of, not that I question recovery, but I sort of question, what does it mean? What does recovery mean for the people who are struggling? Anyway,
yeah, and we get, one of the things that really, I've thought this over time. You look back in history and you see what was being done 50 years ago, 100 years ago in psychiatry or medicine in general, and you think, wow, how could they believe that worked? They were drilling holes in people's heads to let out the evil spirits, or they were bleeding them with leeches to decrease their blood volume, get the bad humors out. You're like, well, that's just crazy. But I've always realized at some point we're going to look back on what we're doing today and say, wow, that's crazy that we ever thought of doing this. I've always been cautious about sort of buying into something wholeheartedly, but this is almost a bit like a crisis of faith in a way, because we've been told there's this dual, co-occurring disorders, dual diagnosis, right? That you're not just addicted, but you probably have depression or anxiety issues as well, or bipolar, which is way too frequently diagnosed. But it's been stay on those meds, and now with Robert Whitaker's books and a number of other authors too, David Healy for another one, that staying on your meds, if you do it for too long, looks like it actually leads to worse functioning, not being employed, being on disability, living a shorter life. And it's like, wow, what do we do with this now?
Right, and I started to worry, and I think I said this a couple of weeks ago. I was thinking. And I actually went to the library and got out the book A Brave New World by Aldous Huxley, just to say, are we at a point now where we all assume that, I need a drug? And, and quite frankly, I'm sort of worried about this idea that there's a group of people who are struggling in life, and what we're going to do is put them on medication. And we're going to put them on medication that may be for a very long time. And on one hand, I guess it's beneficial. On the other hand, I'm not sure it's the right idea. I don't know if it's the right idea that we should I think we should ask for more. I guess I don't know how else to say that. Whether I'm being stubborn about this or sort of committed to being a conservative or what. But I think if we tell people that they need medication to survive, well, they'll believe us, and they'll sell themselves short. They won't recognize that there's more to recovery than just taking the medication, and it's doable. Anyway,
I mean, something impressive with. I heard this first around the idea of medication for children, for adolescents. The idea that if you give them medication for what might just be normal sort of adjustments of childhood, or diagnosing with ADHD, and not being sort of superficial about coming to that diagnosis, that you give kids the message early on that well, you can't manage this, or you can't learn how to handle this, to deal with these issues. And therefore, giving them medication is a very passive sort of thing. Here, you need this, and you're just not sort of fast enough, strong enough, what have you, adjusted enough to deal with this. And so the idea was that really harms their development. But again, as I've been, working with adults in my career over the last sort of, 10 years or so, I've really been bothered by this sense of passivity around people's wellness. It's a medication. If you don't give me the medication, well, you're not really, give me good care. And, do you want me to keep on being depressed? Which is, of course we don't want people to continue to be depressed, but there's so many things you can do that are very powerful that come from your action, changing your actions or changing your thoughts, that would serve people well for long-term wellness, or, if we want to say, call it recovery. So it's always this, so now coming this message now from, all this literature out there these days, I'm less and less sort of enamored with pharmaceuticals.
Yeah. And, and I look for things, and I remember when we used to tell people about relapse from alcoholism and drug addiction, we would sort of, real old school was 12-step programs and stuff. But, they used to talk about high risk of relapse if you're hungry, angry, lonely, tired, things like that. But more and more, it was always about developing a better diet, sleeping. Dr. Kane's writing a book about it, changing your friends, changing the playground. You know what I mean?
Right,
like changing where you go, who you're with, and what you're doing. And, one of the things that you would try and do in treatment and recovery is maybe change the way they thought about things, too. So, 12-step programs are a spiritual program, and we would talk to people about considering prayer, meditation, and to getting better and working a 12-step program. And so, in some ways, even now when I look back on it, I feel like we were, maybe people only heard one message, but we really were saying, look, if you want to get over from addiction, if you want to change your alcoholism, you got to change a lot of things, and they're doable. They're all sort of doable. You figure out where you're going, who you're with, you take care of your diet, you take care of, make sure you're getting enough sleep. You go to other groups and you work with people and you talk to people, use talk therapy. You develop a spiritual life, some kind of belief system that allows you to care about others, to have love in your life. It's really, on one level, I hear myself talking. It's sort of like, for some people it's really daunting, but I realize on that side, then on the other side there is like, well, give me a pill. Mm-hmm. You know what I mean? I understand that, and I always tend to be self-centered about all this, but it's sort of like the difference between the doctor saying, Robert, you have high blood pressure and you're obese and you need to lose weight, and I said, he gave me a pill, and he gave me 2 pills, then he gave me 3 pills, but then over the last 4 or 5 years I lost weight. I exercised, I started doing things, to lose weight again. So, and the hope is that my medication will be reduced. So, I think and I hate to say I was lazy, but I just thought it was easier. Just give me a pill. You know what I mean? I'm doing other things. I'm active in the woods and and all that, but I wasn't doing enough. And I think sometimes with recovery talk, it's I think we do people a disservice. I mean, almost. You know what I mean? In that, it is unfortunate you have a mental illness. It is unfortunate you have addiction, but it's going to take time to fix. It's going to take a while. I can't fix it in this, with one office visit or anyways.
Yeah, yeah. And I think people have been using drugs to relieve their misery for thousands of years, whether they're rural poor or at the onset of the industrial age. Opiates were prevalent just to get through that sort of drudgery and sort of subhuman existence. But I think when you look at research or just writing about happiness, it really boils down to some very simple things, and one of those is people talk about love, and this means partner possibly, but also talks about us being a social animal. You need to have people in your life who matter to you, who care about you. There's sort of reciprocity. If I do for you, you do for me, and we realize that we have a bond like that. But also a sense of purpose. That's something that comes up time and time again too. That if you're going to be happy, it's like when you wake up in the morning, there has to be something you're going to that matters, that you feel is worthwhile. Right. And if you don't have those two things, you're not going to be happy. And I would dare say that's going to mean that recovery's outside your grasp too.
You were saying earlier, and hope you can say it again for the benefit of everybody. It's like, if you're struggling and you have a question and you're wondering about things, there are things to do.
Right. Well, I think back about my own experience. If I've been in a miserable job or I've been in a relationship that doesn't work, the moment I start to think about changing it, I won't say necessarily getting out of it, but I can remember as a kid, I had a string of really crappy jobs, right? And I would just be frustrated, not want to go to work, and I would start to look at want ads. I would start to talk to my friends about where they were working. And as soon as I started doing that, I was able to go to work, I was able to sort of tolerate the customers, and it really made a big difference.
Right. And again, I just want to say that, if you're wondering if you have a problem with alcoholism or drug addiction, or if you're in over your head, or you're worried about depression, you're worried about your thoughts, or you're anxious all the time. I mean, by all means, I don't want to discourage people from getting help. I want to, go get help. Go find someone to talk to. Reach out to somebody. Ask them about it. And like you're saying, just doing that sometimes is the beginning of getting better. It's sort of acknowledging, look, something's wrong. It's not right. Maybe I need some help. I should talk to somebody, but not to say, well, I'm going to go get this med.
Right. Yeah. Because as we were talking about, if you somebody's sitting there wondering, gosh, am I anxious? Wondering, am I depressed? And as we were saying, if you're wondering about it, you're probably still at a point where it's mild enough you could do something about it. It's not like you stop going to work or you stop reaching out to friends, but you're sort of seeing this sort of decreasing quality of your life. And I think one thing we fight against is that I think with the psychiatric diagnoses, they've been sort of creeping down into sort of lower and lower levels of our. What I mean is, no longer do people just sort of severely depressed or struggle with great mood swings of bipolar disorder, but people with lesser and lesser levels of feeling sadness, for example, are starting to think maybe they're depressed when really they're not. They're sad. And at that point, there's behavioral changes. If you take a medication, we're seeing that those aren't really effective for people with lower levels of illness, as we're seeing from these books we've been reading and our guests, may be harmful in the long run, and certainly not as effective in the short term. And that going to see a therapist, going to talk to a counselor, and actually sort of get a sounding board around what your issues are, can really be very, very effective and therapeutic.
And one of the things when I used to try and encourage people to enter recovery, I would tell them that they were coming into treatment because they wanted to stop the symptoms of their illness, whatever that was, whatever was bothering them. But the recovery is about something new in their life. It's not only about not suffering anymore, but it's about life getting better. Yeah. And it's hard to describe that to anybody, to make them understand, because I can't tell their future. I can't tell them, well, this is what's going to happen in the next year or 6 months. I don't know. But I will tell you that if you can stop the symptoms of your illness and stop being wherever you were, begin to get better, change your life, you're going to see a change. You're going to see positive things, things that are, it's not only stopping the negative, it's like developing more positive things in your life. And, you know, whether it's spiritual or physical or whatever it might be, it becomes, you know, like you'll hear I heard somebody say just the other day, you know, that it was their illness that got them sick. It was a terrible thing, but it was their illness that got them into recovery, and that's a wonderful thing. Yeah. And you know, I'd like to offer that to you. I mean, you know, if you suffer with depression, if you suffer with anxiety, it's frightening. I mean, it really is. It's scary, you know. But you have to learn to live with it and overcome it. And life becomes more when you become more aware. I guess that's all I want to say. I mean, I don't want this just to be about, you know, last year we talked about the symptoms, identification and stuff. And, you know, we've had some people on and talk about it. But I don't know if we stress enough that, you know, part of mental illness and part of addiction is not only learning to live with your illness, but figuring out how to get better, how to make your life better, and to have that hope, if you will. I don't know if people get that. I guess that's what I'm saying.
Yeah. And I think, and you know, we've often mentioned that just the fact that you decide you're going to want to make some changes, that's the start of your recovery path. Not when you say, for example, stop drinking for, you know, 1 day, 5 days, 6 months, a year, but when you've decided, you know, maybe I have a drinking problem, that's when your recovery starts, is at that point. And I think, you know, you mentioned Brave New World. I haven't read that for probably 40 years, but there was no tolerance for not being well, right? Life was always fun, life was always good and full, and you know, that's just not a feasible state.
No.
You know, if you think about the yin and the yang, right? It's the black and the black and the white sort of surrounding each other with a circle of white and the black and a circle of black and the white. That there's no good without bad, there's no sad without happy, there's no easy without hard. Right. And that we need to realize that this is part of the richness of life. And just because I happen to be sad for a period of time, that almost can be a rich feeling in itself. It can be important signals to us. The depression is seen, you know, in many ways as sort of an environmental cue or you know, an evolutionary response. And if we don't allow ourselves to feel that thing, like you said, you know, the adversity, what doesn't kill you makes you stronger. I mean, adversity is part of us becoming, you know, fuller human beings and more mature.
Yeah, and you know, and I remember hearing somebody say this, that sometimes one of the problems, and I don't have any proof of this, but one of the problems with addiction sometimes was an attempt to avoid certain unpleasant feelings. And that, you know, because you took a substance from the outside, it gave you some sense of euphoria, even as things were a disaster. And part of recovery sometimes, for some folks, is that they then have to work through the very issue that they were trying to avoid back in the beginning. And many people I've heard say is that recovery is something that you have to go through. You can't go around it. You can't sort of ignore it. I mean, when I used to do a grief group, I used to tell people, you know, in grief group that, you know, grief is something that you experience. It's something that you know, sometimes you would hear people say, are you over that loss, like someone dying? And it's not a matter of being over it. It's more a matter of I've gone through it and I'm changed by it. My life has been changed by it, but it's more, my life is more than what it was. Yeah. And I know that's terrible for some people in grief. It's hard to believe that, but I mean, because they've lost something. But many times they understand that you know, the relationship continues with the deceased, but they also, it isn't just the emptiness anymore. They've gone through the grief, they've worked through the grief, they've, you know, had their sadness and tears, and now they're trying to figure out how do I make life worthwhile? How do I go on with life? What do I do next? And you know, I don't recommend grief to anybody, but you know, it is part of life, and so many things I think are part of life. And I think in some cases we have this idea that we can avoid this unpleasantness. We can avoid doing the work that's necessary. I mean, I remember when I've talked to people about cognitive therapy, And I was saying to one man that the way he was so suspicious of others, almost to a level of paranoia, really affected his relationships. He had struggles with jealousy. And I suggested to him that he change the way he think about other people. And he just refused. I mean, I don't know what else to say. I mean, he just said, "No, I don't trust anybody." I go, "Well, that's not really working for you, is it?" He goes, "I don't care. You can't trust anybody." I said, "No, but you're really having trouble."
So do you like feeling like this? Do you want to keep on feeling like this? Then fine, you've got a recipe for stagnating with this.
I think one of the benefits of working in the psych hospital was I would have this opportunity to look at people and say, "Well, this is where you ended up. This is."
How about let's both look outside these windows here and think, okay, how can we get somewhere better?
Yeah, let's get better. Let's not come back here. And there are things that you need to probably stop doing, but there's also things you probably need to start doing. There's also things that you need to rethink about how you live in the world, because there's something about the way you see people or the way you see your interactions with others. Maybe you can think about it differently. Maybe you don't. I mean, I don't mean this in. Well, I guess I'll say it. Some of the folks I worked with, I felt that in some ways they actually tortured themselves with their own thoughts. It wasn't as if anybody else was pestering them. It wasn't as if anybody else was filling them with fear. It was really, they were doing it to themselves. And the idea that, well, maybe you have to take a look at that. Maybe you can do something about that. I don't know. I don't know if people see that. I mean, I really don't. And I wonder if there's a way of talking about that.
Right, which is often the trick, right? Because if we confront people head on, there's going to be that sort of resistance. They're going to put up a wall. So how do you how do we maybe get them to see in a different way? To see what other people are seeing, and then maybe be ready to make some changes.
Right, and there's the civil rights movement. There was a book, Keep Eyes on the Prize. It was a wonderful book about the struggle and how long it took and everything. But I wish sometimes, when I talk to people in early recovery or people who are struggling with the disease, I wish I could show them the prize. Martin, I've been to the mountain. I mean, I'm telling you, this is a good life. It is there. But in order to get from where you are to where this could be, it's going to take time and effort.
Yeah, and it requires a faith that things are actually going to work out. And if you don't have that faith, I mean, what a lot of people I work with struggle with is that there've never been successes. There's never been sort of satisfaction. And how do you hold that hope that that can actually be had, that there is something called recovery that's worthwhile?
Yeah, and I've struggled with this. I know that there are some genetic biological components to addiction and alcoholism. It seems to be hereditary. It seems to have some problems there. I know it's environmental. I know that some people grow up in really extreme environments of drugs and alcohol. It's cultural. I know for some people it's trauma-based. I mean, there are many, many paths to addiction. There's many, many paths to alcoholism. But there's also many paths to recovery. There's also, ways of getting better. AA has that wonderful line that says, if they have thoroughly followed our path, they're trying to say, look, there's a way out of the wilderness. You know what I mean? Like, take this trail.
Yeah.
But I just feel like there's not enough talk, and you and I have talked about this before. When we talk about the heroin epidemic, and the increase of drugs in the state of Vermont, I would like to say, that the solution is 5 or 10 years from now, there's going to be a lot more people who are spiritual.
Mm-hmm. The pendulum's going to swing back.
Yeah, I hope so.
Yeah.
I mean, that's why I'm sort of worried that, what are we going to do? We're going to set people up for, being on medication for, this sounds so cruel, and I know, we don't do this with other medicine, but I almost get to a point where I say to somebody on Suboxone, listen, I understand getting off opiates is difficult, and we'll give you opiates, and we'll help you regulate it, and we'll, give you some other, but after a couple of years, you should be kind of thinking maybe you're going to get off it. And, you know, I know that's not fair.
I mean, we don't even know.
Yeah,
you know,
we don't know.
Thing. We don't even know.
But, or pay for it yourself. Because I'm not going to pay for it for 40 years. I just don't know. I mean, it's sort of like, you know, I understand the need for it in transition. I didn't understand the need for, you know, why we're changing things in your life, why we're trying to readjust this, you know, the way you think and the way things have happened to you. We'll get you some therapy or treatment or whatever, but not to see this like a medication as the end all, you know?
Right. And I agree with that. I mean, certainly in theory and how we put that into practice, that's a good question, but I often think about the expression, if you teach someone how to fish, if you give someone a fish they eat for a day, if you teach them how to fish they eat for a lifetime, and you know, and just my own personal take on it, but it feels to me that when we write prescriptions, especially if we write them too freely or sort of too early in the whole process, that's what we're sort of giving a fish, and we're taking away from people the message that this requires work. Anybody who's been through adversity or gained a skill in sports or anything, to get to a point of sort of strength and empowerment or skill, you've got to do some work and you've got to struggle to get through that. And we just have to face it. You know, life is a struggle at times, and you're not going to truly be well until you sort of put yourself to these things.
And I also think, and I think sometimes people make generalized statements about addicts and alcoholics that I think are unfair. I think at some point when you got yourself dug into a hole, it's hard to see anything else. It's hard to see anything different. But that's not to say that they would not enjoy a better life. They would not enjoy a life that had more meanings than just taking drugs or just being a drunk all the time. I mean, there's no worse despair than when you have that moment of truth and you look at yourself in the mirror or whatever and you realize that, you know, life is not good and you can't seem to be able to get better. I mean, I think one of the worst things that you can have is loss of hope. Yeah. And I think that's one of the things that you'll see with both alcoholism and mental illness. Yeah. And I'd like to stress that, you know, I want people to say, I have an illness and I want to get help, but I also want them to recognize that, you know, there is a better life, there is a better way, and we can help you get a better way. We'll have medicine, we'll do what we can, whatever it means, but it isn't just let's stop the pain and the symptoms of my disease. It's really about let's make a better life for each other.
And as long as you're feeling, I mean, feeling hopeless and helpless is an awful feeling, but as long as you stay stuck, we know that people who stay stuck in that, people who see themselves as the victim or having no choice, these are not people that get well. These are not people that are able to follow a path to recovery. And not everything that we do in medicine and psychiatry and addiction evidently gets people on that path, and that's the key thing. Yeah. Is to really get people engaged, take that responsibility and to work with us as opposed to you know, being passively engaged and taking medication.
Yeah. You know, and I want to say this, and I might embarrass you, but, you know, Dr. Nels Kloster here, in your work that you do a methadone clinic, you help people with methadone here locally. You also help people with Suboxone. I worked with you in the hospital. I know you've worked with a lot of
psychiatrists. We've had these conversations for years.
And you've helped people to get into abstinence. So, I mean, for you to sit here and be honest and talk about this, I mean, I really, my hat's off to you. I don't wear a hat, but you know, if I have one, it would be off.
I mean, I mean, it's what been 5-6 years now. We've brought each other along a long ways here.
That's right. No, but I really mean it. I want to thank you for your being so open about this and frank about it, because, you know, I mean, you work there, you work with the people, and you're still able to see that. And I appreciate that.
As long as you said my thanks for helping bring me here.
Thank you, folks. Good night.
Good night.